this year again, this disease is back in a big way, and there are a lot of questions. So we're having this panel this morning so that we can hopefully answer some of your questions about it and give a little bit more insight into why we're at epidemic levels again today. I have some of the best experts in North Texas to answer all the questions. And so, gentlemen, I'd like to give you the opportunity to introduce yourself. Dr. Sutker, let's start with you.
My name is Bill Sutker. I'm the Chief of Infectious Diseases at Baylor University Medical Center in Dallas.
Dr. Perkins?
I'm Christopher Perkins, Health Authority for Dallas County Health and Human Services.
And Dr. Catan?
I'm Roger Caton, and I am one of the doctors who had the privilege of treating about 4 to 5 of the people in the last 2 years who've had West Nile.
Okay, thank you, gentlemen, for joining us this morning. We really appreciate your time and your insight. Dr. Perkins, I'd like to start with you, since the vast majority of cases are here in Dallas County, and I know that you all are really at the forefront of tracking this disease. Tell us, from the county health perspective, why you think this disease is so widespread this year.
Well, when we could look at this year compared to the previous 2 years, 2011 and 2010, we think that the environmental effects of a milder winter and also with some additional moisture compared to previous years has made the environment ideal for the predominance of mosquitoes that we see now that are infected with the West Nile virus. Keep in mind that birds are the source as far as hosting, and the mosquito bites the infected bird and in turn bites a human.
And I know we have a healthy bird population this year, which means that there are more hosts for the mosquitoes, so therefore we would naturally have more mosquitoes. Is that part of the idea of this?
Well, we're talking about in regards to breeding as far as the water sources where they can lay their eggs, and because of the less hot summer that we've had, the warm nighttime air and the relatively warm days and the additional moisture that we've had, it made it an ideal environment, and we're starting to see the effects of those infected mosquitoes impacting our human population here in Dallas County.
I know that as of yesterday, there were more than 100 cases of West Nile virus in Dallas County alone, 5 deaths, and there are even more cases that are predicted. This is supposed to be a record year, and I know that you guys are really doing a good job of tracking what all these people have in common. What sort of trends have you seen?
Well, we're monitoring the situation as far as our mosquito trapping, and we have mosquito traps throughout the county. And those mosquito traps, when we capture those mosquitoes, they're actually analyzed to see if they're infected with the West Nile virus. And at this point in time, for any given trap, we're seeing about 75% of those mosquitoes in those traps are positive for West Nile virus. And that in turn tells us that because we're in the middle of the mosquito season, that due to the high infectivity of the mosquitoes, that we're going to most likely see increasing cases in human as well.
Are you seeing any trends in who's being infected or in what area they're living? What sort of trends are you seeing in the human population?
Well, we're seeing that the predominance of the cases are in the city of Dallas, but we do have a distribution across our county. And when we look at the more details where they're located, we're seeing an increase as far as concentration above the I-30 corridor.
I think in addition to that, the people who are traditionally most affected are people over the age of 50 who have underlying diseases or have some compromise of their immune system. But realize it can't affect any age group, and there have been younger patients who have been infected as well.
And Dr. Sutker, since you're on that subject, you know, we interviewed somebody earlier this week whose loved one had been in their 80s and died. They said that that person was very healthy up to this point. So you can be a healthy elderly person. Tell us how that plays a role, how being over 50 may play a role into making you more vulnerable to this.
Well, we don't really think of 50 as being very old.
Right.
Kind of the cutoff where your immune system perhaps starts faltering some, and clearly the older you get, the less prone you are to be able to fully handle the infection, and that's why that age group is affected. In addition, although they may seem healthy, they may have underlying high blood pressure, diabetes, heart disease, or some other illness that might contribute to how the virus can take hold and cause illness.
I know that one of the other deaths here in North Texas was somebody who had received an organ transplant in recent years. Are there other people that may be vulnerable that we should look out for, especially children? What about the children?
Dr. Perkins may want to comment. I think, I don't know if there's been children reported. We see adults at this hospital, and so I'm not really familiar with the pediatric population.
As far as the Dallas County and reports that we received here at the health department, 2/3 of the cases have been over the age of 50, and as far as the pediatric population, we've had just a handful.
All right, Dr. Caton, I want to ask you, because we're talking about who should go to the hospital. What are the symptoms of this, and at what point do you seek medical care for this?
Well, you were asking about some of the older patients who came to the hospital, and the joy of being in the hospital and seeing patients in the hospital are they're usually the sicker ones. They're the ones who have mild confusion, mental status changes, high fevers up to like 102, 103 repeatedly, are unable to like make sense. All of a sudden your loved one who is really talking to you all the time and trying to make sense to you is not communicating clearly to you. It's a little, you would think maybe they're having a stroke, but they're having fevers, they're not feeling themselves, confusion. Those are signs of that the mosquito virus has actually went into the meninges or into the brain, into the CNS, and that's when the risk is highest, because those are 1 in 150 cases of West Nile will have some form of cerebral involvement. That's when those are the people at the highest risk for paralysis, neurological complications, or seizures. Those are the ones that when we see them in the hospital have the worst prognosis, okay? Most of the cases, like we were talking, and Dr. Sucker and Dr. Perkins said, most of these cases are asymptomatic. You and I would get bit by it, maybe have a transient fever, may feel a little bad, but 80 to 85% of the cases of people who get bit by a mosquito, no one does anything about. I mean, and like I saw a dead bird in the alley near my house in the zip code near the 75205 range, and you know, you call the health department and you go, hey, there's a dead bird, will someone please take this? And they go ahead and take the dead bird and have it analyzed for West Nile. But these are the issues that we're seeing, like Dr. Perkins referred to. The mosquito trappings have shown a very high concentration of mosquitoes north of I-30. Like there was a question, why is it so high in Lakewood and Park Cities? We have White Rock Lake right by Lakewood. We have Turtle Creek going through the Park Cities. There are places where we've had very high amounts of rain in the spring, but didn't have much now. So we have dormant water, and it made more mosquitoes. So when they come to the hospital, we're screening people now with confusion for West Nile. It's just like when everyone had the H1N1 scare for swine flu. It's on the mind of doctors when we see people now.
But Dr. Caton, I want to go back briefly. You make a good point in that most people that develop this disease don't even know that they have it. Carter Blood Care confirmed that they had tested positive for over 40 samples of blood. Those people came in feeling perfectly fine, had no idea that they had been exposed to West Nile virus. So in most cases, people won't even have symptoms. But I have to tell you, during the summer months this year, if I came down with cold or flu-like symptoms, I would want to know if it were West Nile, because I wouldn't want to wait until it turned into West Nile encephalitis. At what point do you go to the doctor or go to the hospital and say, you know what, I'm feeling really bad. Should I be tested for this and find out?
No one's going to ever deny you to go to the hospital or talk to your doctor in the clinic, and we can always test people for it. If the symptoms are similar to what we suspect for a asymptomatic or symptomatic West Nile, we'll treat you. But the treatment, there is no specific treatment for West Nile. Once again, like it's all supportive treatment. And when supportive treatment, IV fluids, Tylenol, ibuprofen for fever, just like we do for normal flu viruses. There's no Tamiflu, which is a drug we use to decrease the flu-like symptoms. There's nothing for that for West Nile. There's no vaccine for West Nile. So most things will go away. But if you're uncomfortable, come see your doctor. You don't have to go to the ER unless you're having high grade fevers or mental changes. Dr. Sucker?
Dr. Sucker?
Yeah, I think there are a couple points just to expand on that a little bit. People are now, because it's on the news every day, kind of panicking about getting a mosquito bite and I'm going to get West Nile. And even though there's a large number of mosquitoes, as Dr. Perkins said, that might be infected with the virus, as Dr. Caton said, the vast majority of people aren't going to have symptoms. So just having a mosquito bite doesn't mean you have to go to the doctor. I think if you have fever, chills, aches, you know, as he said, kind of a flu-like illness, and you're concerned, then go. It doesn't mean that you necessarily will be tested, but I think, you know, if you have a health concern that you ought to seek care. The other thing that I think that's important to bring up is that this is not an illness that is contagious from person to person. I've had questions from people who might be taking care of them saying, well, do I need to worry? Is this can I catch this from another person? And it's only spread through the bite of a mosquito. You did mention transplant, and there have been some transplant patients who have gotten it through the transplant, but that would be very unusual, and the vast majority of cases are from mosquito bites.
Right, and I think that the case here recently was somebody who had had a transplant within the last few years, probably was bitten by a mosquito, and then developed West Nile because they had an underlying medical condition.
Right, so they're immunosuppressed because they need to be on medicine so they don't reject the transplant, and that causes their immune system to be compromised and more prone to develop lots of infections.
All right, I don't want to start an argument, but I do want people to be proactive about their own health care because there are some good reasons to get tested for West Nile. I know the test is not as easy as a flu test, but at what point can you go in and absolutely insist to your doctor that you think that this is important for you to be tested for it, just so that you'll know, even if you can't transmit it to any family members that you're living with? Isn't it important to know, and isn't it important to know for tracking reasons? Dr. Perkins, can you take this one?
Well, in regards to monitoring the environment, as I said, we are monitoring the mosquitoes, and then basically the cases that are being reported to us, that give us a clear indication of what's going on in our county. So it's for individuals just to go in and be checked. We already have a clear picture of what's going on, and we're addressing the situation as we see fit. And we're monitoring ongoing, and so basically we have a clear enough picture. If a person is not severely symptomatic and just want to walk in and routinely ask for a screening, I do not advise that.
Okay, and regardless of the zip codes that we're seeing that mosquito pools have been detected as positive or where there have been deaths, people should just assume that this virus is everywhere, it's all over North Texas, and take precautions appropriately, right?
It's like as far as the neuroinvasive, cases that have been reported to Dallas County, and interviewing those individuals, 80% admitted to not using insect repellent. So the best line of defense is personal protection. First of all, wearing proper clothing, long sleeve, long pants, loose fitting, light colored, insect repellent, and then surveying your surroundings, looking for areas where water could collect and be breeding ground for mosquitoes. And make sure your home is mosquito proof as far as the screens on your doors and windows. So and as far as activity, those activities that you want to do, if they're around the dusk to dawn hour, then make sure that you are properly prepared to go out into that environment. If not, stay indoors and to minimize your risk of exposure.
The mosquitoes Go ahead, Dr. Sutker.
Yeah, I think just as Dr. Perkins said, you have to be careful about standing water, and people realize what puddles are standing water, but sometimes you don't think about fountains, decorative things, pet bowls that might be set outside. Anything that has any kind of standing water is potential breeding ground for the virus. And I mean for the mosquitoes who then breed the virus.
All right, I want to answer or have you guys answer a couple of questions that have been sent in for us by people that had concerns. One of them has to do with past research. Now, we've only really been studying West Nile in this country for about the past decade. So nobody, I don't know, maybe we know the answer to this question. I know what past research has shown, but I heard you guys having a little discussion about this. The question is from somebody who said that they had West Nile virus a few years back and was told since they've had it, they cannot get it again. Is that true? Who wants to handle this one? Dr. Sutker, I'm going to put you up to it.
No, that's fine. I think most people would think if you develop disease and as a result of the disease have developed antibodies, which is the natural progression, then you're immune to the virus and probably should not get another case of West Nile virus once you develop the antibodies because of illness.
But could it be like flu virus where just because you had it one year you could still get it the next year, or is it more like some other thing like chickenpox?
Right, it's probably more like chickenpox. With flu, remember, there's different strains that come in. There's A, there's B, they change every year, and that's why people are prone to get flu more than one time. With this virus, it's basically one type, and so if you develop the antibodies, you should be immune to that same type, which is the only type that really is causing the illness.
Okay, our next question comes from another person who'd like to know how to protect their infant son who they think is too young for insect repellent. We know that DEET is best, but not everybody is comfortable with DEET, and especially when it comes to young children. Dr. Perkins, what do you think? Is it safe for babies?
Well, minimize outdoor activity as far as having your infant out in an environment. Now, in regards to the EPA and the DEET, they have no age limitation as regards to applying it to the citizens in our county. However, the American Academy of Pediatrics say do not apply to any infant younger than 2 months.
So what do you do for those infants that are younger than 2 months? Do you just not take them out? Do you need to buy protective mosquito netting? What do you do? And would those babies be at higher risk of developing serious West Nile infection?
I defer that to Dr. Caton.
I'm not a pediatrician, but what we were just discussing before you got on, as you remember, Miss Jennifer, the three of us, most infants are at the highest risk for any infection between 0 to 2 because their first round of immunization starts at 2 months. So most parents are very careful about taking good watch of their kids from 0 to 2 months. But in regards to mosquito netting over your car seats when they go out, covering the baby, wiping them with, like when you're cleaning them, diapers with alcohol wipes and stuff, it actually helps a little with preventing mosquitoes. But I wanted to go back to one point that Dr. Sucker and Dr. Perkins were making about West Nile and the general population and about screening. The reason we don't screen everyone for West Nile, and I know that this was a concern that you were brought up that from a general public people are worried about, is the test isn't easy to do. It's very expensive, and a lot of labs don't even run the test but once a week. So you would get the fluid, and then you have to send it off, and it's not even run but once a week. So the incubation period from the mosquito bite to the time of symptoms is 2 to 14 days. So by the time you get the test back, you already would have been treating them for West Nile. So that's why we don't usually order a test for West Nile on most people, unless we're very suspicious.
Dr. Caton, I'm going to tell you just anecdotally from my experience, what I'm hearing from viewers who have been diagnosed with West Nile is that they go in with these serious symptoms, and doctors have been actually refusing to give them the test. They run a whole host of other very expensive tests. So they end up paying all these bills for other things that it turns out not to be, when they could have and probably maybe should have just tested for West Nile in the beginning as well. Do you think that it's important that we need to consider this disease this summer if people come in with flu-like symptoms?
I think anytime in the mosquito season, like Dr. Sucker was just about to say, yes, you should always consider it's part of the differential of other things. So it could be a stroke, it could be other infections, so it's included in there.
I think one of the things, I'm sorry for interrupting, one of the things and the reason for doing testing is to see whether it is something else that is potentially treatable rather than an illness that we have no specific treatment for and might make you more nervous. And so I'm not sure whether the people you're talking about, once they get that information, are they going to be laying around at home waiting for it to invade their central nervous system. I'm not sure what information outside of just general knowledge. So in general, as Dr. Perkins and Dr. Caton both said, screening is not usually recommended for people who just have mild illness.
Right. And the vast majority of people, we should remind again, have either mild illness or no illness at all in association with this.
Right. The vast majority have no illness at all. And the only reason we know they have it is because they go to give blood or something, as was stated before, and they're found to have antibodies showing that they've had recent disease even though they haven't known it.
All right, gentlemen, we're about 20 minutes into this, so I want to make sure that we give everybody a chance to have a final word. If there's something that you think is really important that we haven't had a chance to address, now's the time to do it because we have all these people that are watching, and they're going to be watching throughout the next few days as well as they want to get more information about it. Dr. Caton, would you like to start? Is there anything that you think the public really needs to know about this?
I think most people would want to know that the prognosis, if you had West Nile encephalitis, is usually very good in 80 to 85%. Of that small percentage, 1 in 150 who have it, who get the very bad case I was telling you about, the prognosis is not so good, and people need to be aware that even if they had West Nile virus, I know what Dr. Sucker was talking about the antibodies, and I agree fully with him, but I still say people who had West Nile, they could get St. Louis encephalitis, they could get another type of encephalitis. Mosquito repellent is important. During the summer, during the temperate, mild winters that we're having, I would recommend mosquito repellent almost from spring to almost winter here in North Texas. And it scares me because I have not three children of my own, but my twin brothers, and I see them running around without mosquito repellent. I bought one of those misting systems now just to make sure that we don't have mosquitoes from now on. Whatever you can do.
Dr. Sutker?
Just to reiterate that point, it's a common disease in Dallas County now, and the best treatment is prevention. We don't have a treatment, and so we need to prevent. Everybody needs to be aware of standing water, search their yards, be careful about when they're outside, follow the instructions that Dr. Perkins gave earlier about clothing and those kinds of things. But prevention is what we need to emphasize here.
And Dr. Perkins?
Yes. In regards to minimizing mosquito bites, remember, prevention is the best medicine. So that one mosquito not only could be a carrier of West Nile, but it can be some other disease that we don't want in the first place. So taking the necessary action by applying insect repellent, and if you're outdoors extended period of time, reapply, follow the directions, and we can get through this.
And really, bug spray is such an easy way to prevent this. I know people don't like to put it on sometimes because they think, well, I'm only going outside for 5 minutes, and I don't want to feel sticky, whatever it is, but a few minutes is all it takes. A few seconds is all it takes to get bitten by a mosquito. So if you don't like it, still put it on, take a shower afterwards, and know that you may have done yourself a whole lot of good just by taking those few extra moments to apply some insect repellent.
That's right, because those few moments to put it in are a lot shorter than once you get the mosquito bite worrying about it for the next 2 to 14 days.
Before we leave, I do have one more question that's just come in from somebody who's worried about their pets. You know, our pets are our family members as well. So, Dr. Perkins, I'm going to let you handle this one because the other guys are doctors who handle people.
Well, in regards to our pets, there have been studies that have illustrated that dogs and cats are actually infected with West Nile virus. However, they do not have the classic symptoms like a human, and they generally don't have the viral load or the advanced disease that has been demonstrated as far as fever to neuroinvasive. So by far and large, you can take extra precaution to minimize your pets from being bitten, but generally they don't have much complications from this at all.
I know.
As far as the heartworms and so forth, you know, mosquitoes can spread other diseases to our pets. So the main thing is to also protect them because of other disease that they can get from mosquitoes.
I know people are going to ask, can you put bug spray on a dog or a cat?
Check with the veterinarian.
Okay, great advice. Gentlemen, thank you so much for joining us this morning and adding a lot more insight into this epidemic of West Nile virus this summer. We hope everybody has listened to your comments, takes heed, wears bug spray, wears long sleeve at dawn and dusk when the mosquitoes are out there biting, and dumps out their standing water in their yards because that's where the mosquitoes are coming from. That's where you're going to get it from, and so you can take this matter into your own hands and protect yourself from West Nile virus this year. Gentlemen, thank you very much for joining us. I'm Janet St. James from WFAA-TV in Dallas, and I'm so glad that everybody could be here today.